there. Welcome to another episode of The Healthy Enterprise. My guest today is Dr. Steve Schutzer. He's the co-founder of Upswing Health. He's also a focused, innovative, and visionary healthcare physician leader and strategist with an obsession for improving the patient experience in healthcare. Looking forward to this conversation, and I hope you are too. Let's get started. Steve, thank you for joining me today for this episode. I really appreciate you giving me your time. I'm curious to learn more about Upswing, as listeners will too, but why don't you introduce yourself and explain who you are and what you've been doing and where you got to where you are today.
Yeah, hey, thanks so much for the opportunity to be with you today and share a story. You look back over your career and your life and you wonder how it all unfolded,
Yeah.
Series of events that are never planned, but a door opens and you sense it and you take it. But I'm just I consider myself above all a very lucky kid from the Bronx, born and raised in the city. My parents were the first folks in their families to go to college. My dad actually was a politician, which may explain some of my success. Because he never forgot anybody's name or could always shake a hand. But really, I did learn a lot from my dad in terms of how to communicate.
Yeah.
He was an attorney, and I actually clerked for him one summer when I was 15, thinking about law. And I said, "Dad, you do anything in your life other than talk?" I didn't like that at all. At that point, I knew being a lawyer wasn't for me. But I really kind of gravitated to the sciences and always had a sort of inquisitive mind trying to solve problems. And when I was in med school, Heath, I wanted to get, and it was a lot less expensive then, obviously.
Right.
I wanted to get off my parents' dole, so I took a Navy scholarship. I signed up with the U.S. Navy, and they covered a great deal of my medical education. Of course, the payback was, I had to enlist when the time was right. And, talking about certain things that kind of work out where you weren't planning, they wanted me as a surgeon. But then 1 year into my surgical training, they said, "We need you now." And I said to the Navy, "I'm not ready now." They said, "Son, we need you now." And I realized that I had signed something I really probably didn't read completely.
Right.
They had me. So long story short, again, under the category of these things kind of work out, I was actually dating a woman at the time. I said, "She's not going to be here 3 years from now." So I decided to get married. And I became a primary care physician in the military. I ran a medical clinic in Puerto Rico for a few years in the Navy. But, these things just start to formulate your worldview, right? And people said that all through my career, I obviously went back to become an orthopedic surgeon, but I think like a PCP. I think like a primary care doc, which I think is a compliment. I think beyond the bones and the joints and all that stuff. But that's what I did. I went to med school at UVA. Very lucky to get into UVA, and then did my surgical training in Rochester, New York, in surgical training. And then I went into the Navy, came back to do orthopedics at the University of Connecticut here in Hartford. And then, once you decide you want to be an orthopedic surgeon, there are about 10 different subspecialties, Heath, that you can spend your career. Because most of the orthopedic surgeons don't do general orthopedics anymore.
Right. Okay.
And for me, a love of carpentry, and I rotated on all of these different orthopedic subspecialties. But I can tell you, Heath, giving somebody their legs back is such a gift. Right. So I became an arthroplasty surgeon, otherwise known as a total joint surgeon. And so for 37 years, I replaced about 12,000 worn out joints, hips and knees in particular. And it was just a great, to see people of all ages get their life back, until I haven't had a joint replacement, my wife has, but just to be disabled, from 40 years old, 50 years old, 80 years old, and to get that back. It was just a gift that I was given to able to do that. So that's a little look at my orthopedic career.
When they said we need you now, you had to put your education on hold then, and then you went and did your enlist. You went to your enlisting, and then you came back and finished your education. Was that right?
That is correct.
Oh, okay.
So I actually had a little hissy fit because I said, The politician, Dad, you got to fix this. All right. I'm not going to the Navy now. I'm just getting started. He said, he says, son, you're stuck. Did you read this contract? So, but it was one of those things, and it's important for listeners, young listeners, to know that everything doesn't always go your way, but make
Yeah.
something of it, right? It was the best thing in the world for me. I made the right decision for my spouse, and I learned primary care, and I was still young, very young. I was a little ahead of my years. So I went back to do my surgical training and then orthopedic training, and then was blessed to get into Mass General in Boston for my joint replacement training.
Mm. And you saw the world. So you saw
Yeah.
things from a different perspective too, which is also very helpful. Yeah.
And I worked when I was a diving medical officer, a little sideline.
Oh, okay.
I know the Navy SEAL team very well, and talk about folks that are inspiring. They're just superhuman beings. So had an honor to be their team doc for a number of years.
Interesting. Wow.
So great experience. If you can
Yeah.
see how things start to formulate,
Yeah.
very, very blessed.
So then you came back and now you're practicing. And you did that for how many years did you continue
Yeah,
doing that?
so I finished in Boston and I had opportunity. These are the decisions that you have to make. I was invited to stay in Boston with my mentor, who I love. He's still alive, and he's smarter than I'll ever be. I had an opportunity to stay there, which was a great opportunity. Mass General would have been quite a deal, but I just didn't want to be a small fish in a big pond.
Mm-hmm.
And again, I had done my orthopedic training here in Hartford. It's only 90 miles away. It's halfway between New York City, where my family was, and halfway to Boston. And I decided to come back here in Hartford and try to make a bigger impact in a smaller community.
Mm-hmm.
And but I want to highlight one important comment here, because talk about mentorship, and that's what I'm trying to do now with my life. But keep in mind, at that point I was 31, maybe 32,
Mm-hmm.
and my mentor was a taskmaster. He was not easy. He expected he had two fellows every year. He expected us to know everything about every patient. And I don't mean just their bones. I had to know their electrolytes, their blood loss, and everything in the management. He counted on us, and there was no BSing this man. But every morning we'd have rounds at 6 o'clock, go over the cases for the day and the patients. And he would look over his wire rims like this, and he'd say, Steve, don't forget, you got to leave it better than you found it. That was
That's good
every freaking
advice.
morning, and okay, I got a lot of work to do. But it actually stayed in my brain that when I finished and I left Boston, and we stayed very close with Dr. William Harris is his name,
Mm.
stayed very close. I still see him to have dinner once in a while. But that stayed in my mind, because he had such an impact
Mm.
on orthopedics. Without going into too much detail, before the year 2000, Heath, the implants that we would put into people would last 10 or 12 years.
Oh, wow.
That's it. Especially young people who beat them up, right?
Sure. Yeah.
80-year-olds, doesn't matter.
Yeah.
So consequently, we had patients wait until they're 55 or 60 in pain. And yeah, well, he took 8 years to make a new material called cross-linked polyethylene. And without boring you with all of the chemistry behind it, he released that in the year 2000 with a promise of extending the longevity of these implants.
Oh, wow.
Well, comes now 25 years later, the patients that I did in the year 2000, those that are still alive, look like the day I put them in, Heath.
You're kidding. Wow.
No. And he really
Wow.
deserves the Nobel Prize.
No kidding.
No, he changed the world, because this cross-linked, sure, he had one patent on it and another patent, but now that is a standard implant around
Mm.
the world for the last 25 years. So if you know anybody that has a hip or a knee, a shoulder, or an ankle, they really owe Bill Harris a debt of gratitude.
Isn't that interesting? I've seen the parts actually that go in. In fact, they're quite, when you see them when they're not in place, but you see them, they look like, toy parts, plastics and various things. So I've seen the parts before they go in for a hip replacement.
There you go.
And you wouldn't notice if if you didn't know that that's what they were, you wouldn't even guess that was going to be a new hip for somebody. But
And,
all right.
and Yeah. So, and the problem that was solved with this new material is the bearing surface.
Yeah.
All the other stuff had been fixed, but when it comes to metal against plastic, how quickly or how durable is that material to Heath jumping on it, shooting some baskets or whatever you like
Hmm.
to do, right? Any rate, that was a major milestone in my life because that thought of leaving it better than you found it.
He
Uh,
really, he really gave, he really gave that to the industry that
really did
everybody can leave it better than they
in
found it
many,
now.
many, many
Wow.
ways. Yeah, no,
What a
very, very.
legacy. Yeah, what a legacy. And then you went ahead and you probably, I think I saw or heard you did over 10,000 surgeries in your career.
Did a
Is that
lot,
true?
and
Wow.
along came this other opportunity that we'll talk about, these centers of excellence, which necessitated me cutting back on my volume.
Mm.
So here again, these opportunities arise. So let me just go into a little bit about this. But around 2006, 2007, we kept hearing about this epidemic of joint replacements as people in my demographic, I'm a baby boomer, came of age. Just the explosion of volume,
Yeah.
right? Not to mention maybe we were a little more active than our parents were, but we heard about this impending volume about to descend upon us.
Hmm.
At a time, Heath, now picture this 2006, I was getting 3 cases done in a day, right? An 8-hour day
Wow.
with 2 hours between cases, right? Having no personal input in anything other than I bring my patient, I do my case, they let me do the materials that I want, but I had no input on any of the operational aspects of the patient journey, none.
Hmm.
So I was doing 3 cases in a day by 4 o'clock, and so we had an idea, an inspiration to build a center of excellence for joint replacement, arthroplasty here in Connecticut. And it was not, it was a big deal because we had to bring together a lot of egomaniac orthopedic surgeons and say, listen, we can bring together a lot of volume and we can leverage that volume to a willing hospital partner. Now, today, many of these are done in a surgical center, but
Hmm.
2006, 2007, until they were hospital based.
Hospital. Yeah.
So we had this idea, and long story, we built a management company of 10 arthroplasty surgeons. We assembled a lot of volume and we went to one hospital and said, listen, we have an idea. We want to build a hospital within a hospital, right? Let us show you how to do it. Let us run it. We'll show you the money,
Hmm.
but let us run it. And we went to Hospital A, no need to mention who that was.
Nope.
They said, if we do it for you, we have to do it for everybody. And we said, are you sure? And they said, no. And that was my base hospital.
Right.
So we went 1 mile across the street to a smaller hospital, faith-based. And we said, listen, we have this idea. We want to build a center of excellence. And they said, dude, here are the keys. Come on down. It's yours. Are you kidding me? Within the limits of the law, and the contract said, the last every paragraph says that it's called St. Francis retains the authority. It's their space. We don't own any of it.
Right.
We're there to manage it.
Right.
And it was a very novel idea. Everybody was laughing at us until they stopped laughing because the surgeons were coming from 50 miles away to
Wow.
our unit. Now, why would they do that? Because rather than do 3 cases in a day, they were doing 8 cases in a day.
No kidding.
And we were collecting their data. We had protocols. We had a family. We really were a hospital within a hospital. We wrote this up in the New England Journal of Medicine. And it was so successful for joint replacement. Sometimes professionals are jealous of one another. It's a
Right.
natural thing.
Yep.
So my spine colleagues that hated us for a year, hated us, all that. And I said, after a year, I said, you know what, this seems to be working out pretty well. Could you share your agreements with us so we can build a spine center of excellence? And we did that. And then the sports doctors came forward and said, hey, we want to do this in sports. We gave them that. And then the trauma doc. So long story short, within 2 or 3 years, we had 4 centers of excellence, subspecialty based, all private, working with a hospital partner.
Hmm.
And they asked me to be the physician executive overseeing all 4 of them so I can keep
Oh,
them up.
wow.
And it was just the most amazing experience, Heath. And it really became a prototype of how physician entrepreneurs can work with hospital systems that
Mm-hmm.
allow us the latitude to just let us show you how to do it, right? We don't expect you to know everything, but just let us show you how to do it. And the COO actually said to me, this is a direct quote. He said, Steve, my job is say yes and get out of your way. Now, you don't hear that much anymore, Heath,
Yeah.
and that's a
Yeah.
problem,
Yeah.
right? Everybody's got their own lane and they protect their lanes.
Yeah.
This is how it was for about 15 years. So it gives you a little idea of the success we had. And
Yeah.
it was just an amazing run. And, to call yourself a center of excellence, I don't know how it is in Canada, but there are billboards over every highway. We're the best in the world. But we had data to support that, right?
Yeah.
We were validated by the Validation Institute. We were validated by the American Board of Orthopedic Surgeons. So it wasn't just a lot of nonsense. These were validated. The frustrating part, and this can segue perhaps into the next conversation, is that for all that we did to create an unbelievable patient experience and to create very low price points, we never moved the market.
Hmm.
And that was my first foray into healthcare,
Mm.
right? I thought with the prices being as low as we drove them,
Mm-hmm.
with the experience being five-star Nordstroms,
Yeah.
that employers and health and the payers, they would be banging our doors down,
Yeah.
right? But that, then I started to have an awakening how difficult it is.
So what was that? What was that hurdle? What was it? What was the difficult part?
Well, boy, I'll tell you, we can talk about that for hours, but it has to do a little bit with financial incentives.
Right.
That's one big thing, okay?
Yeah.
And then we have the status quo, right? And I'm sure you're following all of the problems with employer-sponsored healthcare and
Mm-hmm.
all of the opportunities they have to fix it. It's just overcoming. Again, there are financial disincentives. Without pointing to one stakeholder, there are brokers and there are TPAs and there are consultants that are between me and the
Mm-hmm.
person who's paying the bill.
That's right. Yeah.
Layers of intermediaries,
Yeah.
and each of them have a hand, in the pie. And if they, if they're doing well, there's really no reason for them to change. Are you familiar with a piece of legislation, maybe one of your other guests, called the Consolidated Appropriation Act, or the CAA?
No.
Okay, that's critically important. It was signed into law by President Trump for a few days before he left office, January 2021. And basically, what it does is it's one of the longest piece of federal legislation in history. It's 5,000
Oh,
pages.
wow.
No one reads it, of course, but embedded in that 5,000 pages may be the most consequential federal legislation in 50 years. Because what it does, Heath, is it makes it explicitly clear, black and white, no gray, that the employer has a fiduciary responsibility to act solely on behalf of their employees
Mm.
in making their healthcare decisions,
Mm.
just like a 401k retirement plan, right?
Okay.
So it's in black and white language. And I thought when this was signed, this would solve the problem. The problem is that employers still don't know about it.
Mm.
Many of them don't know about it, or those that do, they go, well, it doesn't apply to me. Heath, it applies to all employers with over 50 employees or more. And the penalties that they're at risk for are substantial and they're personal.
Really?
They're not covered by insurance. They're the employer's responsibility, right?
Wow.
And the language is extremely clear that it's not black and white as a lot of legislation is. So now what you're seeing emerge on the scene are breach claims,
Oh,
right,
okay. Mm-hmm.
by employees. And they're usually in very large companies. The big one was J&J about a year and a half ago.
Mm-hmm.
Wells Fargo had one, where employees are saying, wait a minute. And it affects the employees because, listen, employee goes, let's say they need a medication. They can buy it out of pocket for $100.
Right.
If they buy it through the health plan, it's $2,000, right? Of which they pay co-insurances and co-pays and
Right.
deductibles. They don't even need it, but they have to use the health plan,
Right.
right? So that's the genesis of these lawsuits now. So there's a little saying now, if you can't legislate, litigate. And that's what we're
Mm.
starting, unfortunately,
Yeah,
that what
that's
we're
too
starting
bad.
to see unfold.
Yeah. Yeah, and you were seeing more direct pay too, which is also interesting because
Huge.
it cuts through a lot of that debris, doesn't it?
Yeah, let's talk about that for a second because, again, I've been involved with these initiatives now since 2006, banging my head against the wall. But I live for bright spots,
Hmm.
right? You've got to live for bright spots.
Oh
You
yeah.
find them, you stick to them, you enhance them, right?
Yeah.
And one of the bright spots is direct contracting, direct pay. And when I first heard about that 2 or 3 years ago, I said, why? We have insurance, right?
Right.
And here's one reason in a nutshell. Because an employee, let's say you want your joint replacement done, you can go to Oklahoma Surgical Center, internationally known now. You look at the website, go, oh, I can get a hip replacement, $17,000 all in. I go to my employer and said, hey, I can get a hip replacement, knee replacement, $17,000. Can you reimburse me for that? The employer goes, I'm paying 68 or 70,000. I'll send you in a first class seat to Oklahoma and you and your spouse up to a hotel. I'll reimburse you to 20 grand. I'm ahead 60.
Yeah.
So that's what we're starting to see now. The employers are
Right.
reimbursing their employees for paying out of pocket.
Hmm.
They pay cash.
Right.
And,
That's where
and
these healthcare spending accounts are all starting to arise too, right?
interesting.
Same
Yeah,
thing. Yeah.
and they're being looked at and modified by Congress now to make them more flexible.
Hmm.
Right now, they're very limited as to what they can use the HSA
Hmm.
for, but they're trying to make them more flexible. But even if they were to simply pay out of cash, if the employer goes, yeah, I'll pay for your ACL, Oklahoma, or anybody else that has transparent pricing,
Yeah.
and cash,
Yeah.
right?
Yeah.
So this whole movement to direct contracting, cash pay, is one of the ways we might be able to disrupt and topple. It's a big word, topple the
Hmm.
book, the major insurance carriers.
Hmm.
That's a
And
big
then
milestone.
And unless the insurance, actually, I've had conversations about insurance, about how potentially some of them are looking to change their incentives towards more preventative healthcare too, where there's incentives to actually hit benchmarks where your medical records are showing an improvement in your healthcare. You've lost weight, your blood work is looking better, and then there's incentives by insurance companies to say, we'd rather you take care of yourself than wait till something happens and then we got to cover your ass. But have you heard any of that?
Yeah, I'd like to say, first of all, I agree with you, but I'd like to say that's really happening. Because keep in mind, one of the shortfalls of the Affordable Care Act was that it set the medical loss ratio, the ML ratio, at 85%.
Mm,
So they can only take 15% of premiums towards profit. Well, the higher the premiums,
right.
the bigger their piece.
Yeah.
Well, that's a major obstacle. Again,
Yeah,
it's
that
those
is.
financial disincentives. Having said that, the other bright spot that I cling to before we talk about Upswing is a direct primary care movement. And that's kind of tied to the first thing we just spoke about, the direct contracting.
Hmm.
Because have you following the direct primary care movement?
A little bit. It came up in a conversation the other day, but
Yeah,
you can elaborate for sure.
it's another one of those bright spots that we have to accelerate and amplify.
Hmm.
So it started as concierge medicine. So when my folks were alive living in Florida, I bought them a concierge doc so I knew somebody would take care of them.
Right.
Well, these are the docs. I forget what I paid them, but they made a decent, but they limited their panel to 500. My folks had their cell phone in case they needed something or showed up in the ER. So that's what you were buying.
Right.
But that was really no. It was just no. Everybody couldn't afford that, and I was very lucky I could. But along comes this direct primary care, probably 5 years out now, but probably most known by the Health Rosetta was one
Hmm.
organization. The other one is called Hint Health, which stands up these direct. They call them DPCs. But basically what they do is they don't take insurance. They limit their panels to somewhere around 800. They get paid on a subscription fee, and it varies depending on the model, somewhere between $50 and $100 per household member per month, depending on the model. And the models do vary. Some of them use more nurse practitioners, some are
Mm-hmm.
doctors. But the employers are now saying, well, listen, so for, $1,200 a year, I can keep a family healthy because they know that basic primary care today, to no fault of their own, not blaming them, they have 15 minutes to see a comorbid diabetic, and
Right.
who can do that, right? No one can
Yeah.
do it. But the DPCs can actually do that. They spend the time, they have 1 hour sessions with their patients. So this is another big movement that needs to be amplified, direct primary care. And this company called Hint Health stands up 10 to 16 new DPCs per month, but they tend to be small, right?
Mm-hmm.
They're 2 and 3 and 4 or 1. But there's some that are very big and that we're working with now through Upswing. So that's another big bright spot, and the employers are stepping up to do that as well.
That's a shift for sure. Yeah. That must be inspiring to see. Yeah.
It is, and it's good for patients.
Mm-hmm.
There's a whole layer of primary care that I'm enthralled with before direct primary care. That's called functional medicine, right? And not to pitch somebody else, but if you ever want a functional medicine physician on, that is really fascinating to me.
Mm.
Are you familiar with functional medicine?
No, not that much. Fill
Yeah.
me in.
So, DPCs are great because they take care of sick patients and they make them a lot better.
Right.
What about getting to the patient before they become sick?
Mm-hmm.
Novel idea,
Mm-hmm.
right? So these functional medicine doctors probably, and there are some that are very, very famous. Dr. Mark Hyman tends to be one of them, very well-known guy
Mm.
here in the States. They're MDs, but they approach healthcare as a research scientist.
Mm.
So most of them have a degree, listen to this, in nutritional biochemistry,
Mm.
right? Because they look at everything we stuff in our mouth as, just like taking a pill,
Yeah.
right?
Yeah. Yeah.
You take a bite out of a piece of chicken, who knows what hormones and ingredients and pesticides and crap that it has in it. That's
Mm-hmm.
what they look at.
Mm.
So
A little more
they have,
holistic, eh?
well, very holistic,
Yeah.
but also very at the cellular level of,
Yeah.
right?
Yeah.
I'm going to pitch a good book called Good Energy that I'm just trying to read by a young functional medicine doctor. And it looks at everything at the cellular level. So functional medicine docs have a saying about traditional medicine that we like to name and blame. We say, Heath, this you got a diagnosis. This is your diagnosis, and if you don't get better, we blame you for not getting better.
Right.
I thought, well, that's kind of true in some ways.
Yeah.
But what the functional medicine doctors do, they think and they link. Okay, so Heath has 4 or 5 different health problems. Is there a root cause of them? Could it be his diet? Could
Mm.
it be his medications? Could it be all of those things that are linked together
His
with a
stress
common
level.
stress? Oh, that's root of all of it.
Yeah.
Sleep,
Yeah.
stress,
Or lack of. Yeah. Diet.
and
Yeah. Activity. Yeah.
the impact of lack of sleep, of cortisol on your cell function is something
Oh,
that we
yeah.
think about. But think about how wonderful a world we would have if we prevented people from getting sick in the first place.
Right. Right. It kind of ties in too with that with psychoneuroimmunology too, right? That's an interesting combination, a three-way intersection of those
Absolutely.
studies, and which talks about keeping the body in a state of homeostasis so that it's
No,
functioning in a balanced environment as opposed to being you know living in a state of
it's
survival.
so important,
Yeah.
especially for young people, because, just as a disturbing statistic, if you look at the rise of early onset cancers,
Hmm.
it's not in 80-year-olds. I mean, everybody did cancer in the 80s. They're in 30 and 40-year-olds.
Wow.
And it's going,
That's too early.
it's going like this.
Wow.
Yeah, that's very weird. And it's got to be something in the environment, right?
Yeah. Yeah, it's something that we're doing. I mean, do we really know the effects of cell phones yet?
Yeah, no, don't.
We don't know.
You
We
know,
don't know. We've only
once,
had, we've only been carrying around portable cell phones for 20 years. So
yeah,
we don't
no,
really know.
uh, it is very scary, and it really starts with the neonate, the baby, the in utero,
Mm,
the mother's diet, and all of
hmm.
that. So
Yeah.
I'm really excited about functional medicine. We had someone
Yeah.
on our podcast a couple of months ago that just blew me
That
away.
is exciting. I'm going to look into that more. Yeah.
Yeah, we'll
Thank you.
talk about that
Yeah.
offline. But do you want to know a little bit about Upswing?
Yes, because I want to go back to something you said earlier, and that was entrepreneurial medicine. And it was interesting listening to you talk. It's great because you've kind of experienced a world when you went into practicing, and you discovered areas that weren't really working. And I've heard this before. It's like people choose their profession, they go to school, they choose their profession, they and get their jobs, they start their practice or whatever it is they're doing, and then they find that something doesn't work, and particularly a lot of our conversations are in healthcare. So it's like, this didn't work or this isn't working. So I had to come up with something to fix this.
Mm.
And, I don't think every doctor or medical practitioner decides to be an entrepreneur, because it's a very different profession to be
Yeah.
practicing medicine or being an entrepreneur. But so many cases where you got to be both, or you morph into being both. And so this is where you're coming to now, is Upswing. So at some point you had to shift gears and become an entrepreneur, and
Well,
that's where Upswing came in.
if you think about the early part of our conversation with building these centers of excellence, that's entrepreneurship. It's
Hmm.
not tech entrepreneurship,
No, but yeah, you're right. Yeah.
entrepreneurship. We had to solve a problem.
Yeah.
For me personally, it listen, if you have 45 orthopedic surgeons, you can't manage by fiat, right? Good luck.
Yeah.
You'll get to figure it out the door. So I had to change my personality. I had to
Yeah.
read about social sciences. Again, I talked about my father was a very effective politician. How did
Hmm.
he was a Democrat, but he ran both sides of the aisle. And, you had to learn how to communicate and persuade. I also study martial arts, and I learned the art of being soft and not being hard.
Right.
So all of those things became effective for me as my tools. We all tend to react when someone gets in your face and tells you to go screw off. You're a jerk. But you got to take a step back and not process that a little bit. So
Yeah.
all of that
Maybe
leads
do they
up.
have a point?
Yeah, they have a point. And actually, while I was before we started these management companies, so forth, I actually developed a couple of implants, orthopedic implants that to solve a problem. I worked with Dr. Harris. We had a couple of patents on implants too, preceding these arthroplasty institutes. But yeah, so what happened was, just before COVID, probably 5 or 6 years ago now, my partner, Dr. Jay Kimmel, ran the sports program. Really great guy. His wife is actually a psychologist to help help my training about, and she's interested in motivation.
Oh,
So I learned
wow.
from her. Dan Pink, another one. But anyway, Jay said one day, looks like we've fixed the surgical part of orthopedics, right? We had these humming surgical centers and all that. It was beautiful. But Steve, what about when somebody rolls their ankle or
Mm.
they pull out their back picking up their kid? And because I can't tell you how many times I have, and again, I'm a hip and knee surgeon, how many times I've seen patients come into my office having had major spine surgery. And I look at them walk in the office. I said, God, your hips are shot. It's not your back at all.
What?
Yo, many, many times.
Oh my
Again, I'm
God.
not blaming anybody,
Sure.
but we all have tunnel vision, right?
Yeah. Yeah.
If you go in, you're complaining of leg pain, and you get an MRI, and your MRI shows a little something in your disc,
Yeah.
you get a spine operation, right?
Wow.
And all of the patient, and not quite as radical as that. And again, not pointing fingers, but patient sees a primary care doc. They're not trained in orthopedics, right? So they send somebody to get some physical therapy.
Yeah.
Again, not blaming physical therapists, but they don't have a diagnosis. Go get
Right.
some therapy. So they go back to the primary care doc. It still hurts. Well, let's get an MRI scan. Well, the MRI scan in people over 60 are always going to be abnormal in any part of your body.
Right.
And then it leads to seeing a surgeon and all that sort of stuff.
Yeah.
So bottom line is, so Jay said, what if we built a company to catch the patient, and we call it an ouch moment.
Hmm.
We all have ouch moments, right? You
Mm-hmm.
probably had an ouch moment.
Yep.
And now you
Recently.
know me. Now you know me. You've got my cell phone and my email, so reach out to me before you go to the emergency room.
Okay.
But if you don't know a Steve or a Jay or someone like us, and it hurts really bad, you go to the worst place in the world. You go to the emergency room. You walk in, they get some X-rays, they give you a prescription for some Vicodin, and they say go find a surgeon, right? And you know, or you go to your primary care doc or urgent care, but who you see for that very first visit, for whatever your problem may be, dictates the cost and the outcome of that journey,
Right.
right? And we have data to prove that.
Yeah.
So we built a company to give people answers to the questions that the two key questions are: what do I have and what do I do? Right? Those are those two key questions. And we built technology to give people those answers. And it's pretty darn accurate. We built the algorithms so you can go on and you can get an answer. You plug in some answers to these questions, and you got a pretty good insight as to what your problem is and what to do about it. We
Interesting. Okay.
create PDFs and all that sort of stuff. Is when do you go to the ER? Basically, Heath, if you were playing soccer, you rolled your ankle, and you finished a soccer game, you don't need to go to the ER. Your
Right.
ankle's not broken, right?
Right. Right.
So anyway, we built these algorithms. Then we hired athletic trainers. Are you familiar with athletic trainers?
Yep.
Okay, so little dirty secret, not such a secret anymore, but they are the most underappreciated stakeholder in
Mm.
orthopedics.
Mm.
Right? They're underpaid, they're undervalued, but they're really good at front end management. This is what
Right.
they do.
Right.
They see you or your kid on the field, they make an assessment, they go, you know, it's a little sprain, it doesn't need to see a surgeon. So they do immediate assessment and triage.
Mm-hmm.
So our front door is technology and athletic trainers.
Hmm.
So
Oh,
they
really?
make these assessments and they're very low
Oh,
cost, right?
right. Right.
And then they have three choices. They say, you know what, I'm really worried about Heath's shoulder, neck, back, whatever it may be. I'm going to set you up to see one of our orthopedic docs same day or within 24 hours. Now, you know, it takes 3 weeks to get in to see an orthopedic surgeon in this,
Right. Right.
probably in Canada, probably 6 weeks or a month, who knows. But we do that within 24 hours. Or the athletic trainer may say, you know what, I can manage this low back strain with some exercises and so forth. Don't need to go anywhere, right?
Right.
Or we have our own physical therapy. So three options that the trainer can do, all virtual,
Yeah.
right? So, and what we're doing now, the results really quickly is that we're managing 85% of the patients that come to us without escalating out of upswing.
Right.
So just use your
Amazing.
imagination. If
Yeah, I was
those
gonna.
80,
I was just gonna clarify too for listeners that we're
yeah,
talking about Upswing now. Is this system that where that's your front line is the athletic trainers? Yeah. Okay.
that's right.
Yeah.
We call it the front door
Yeah.
is the technology. And again, we can't do a demo right now, but the technology and the trainers are the front door, and they're available all the time to make that initial assessment. And sometimes the trainer may say, you know what, Heath, actually, you can't walk on your ankle, or you blew out your back and your foot is numb. You need to go to the emergency room. There's a reason for it, right?
Right.
But imagine of those 85% that we're managing all virtually with our technology. We get MRI scans now on our own and all that sort of stuff. Imagine if they went through traditional route, how much that would cost, not just to the people paying the bills, but people pay co-pays and out of pocket and so forth.
Right. And
So
adding to the lineups and the backups and the
exactly,
understaffing and the wait time in ER and what have you. So all that you just alleviate all that
exactly right.
problem. Yeah, that clog.
So
Wow.
we say that, and I want to point out something, because if you look, I just wrote a paper. I'll share it with you when it's finished. Um, the evolution of management of orthopedics. It started with Walmart in our country in 2012. I don't
Hmm.
know if you remember this at all, but Walmart started a Center of Excellence program with the Cleveland Clinic. And they
No,
said,
really.
do you
Wow.
remember that? Oh, you maybe didn't know that.
I don't
Yeah.
know. No,
They sent every Walmart employee that needed a cardiac procedure to Walmart. I
you're
mean, sorry,
kidding.
to
To the
Cleveland
center.
because they had a Walmart, because they have the best heart program in the country. They
Wow.
negotiated a bundle payment, a package price, right? and they all went there. Well, that spawned an era of bundled payments and centers of excellence, lots of them.
Hmm.
And I love them, right?
Yeah.
Big focus on centers of excellence, negotiated price point with a warranty. The surgeons are vetted out for the highest quality. A lot of focus on the surgical side.
Mm-hmm.
And my COEs that I was telling you about, we play with all of them. So it's
Mm-hmm.
important. The next evolution, just before COVID, came companies like Hinge Health and Sword, the virtual physical therapy companies.
Mm-hmm.
And they filled a gap. And along comes COVID, shutdown. You really needed virtual physical therapy.
Yeah,
So
no kidding.
they exploded in
Yeah.
volume. And they do a great job at what they're doing. We actually have a partnership with Hinge, with Upswing and Hinge have a partnership. So we work together.
Mm.
But the problem is, first, one is all surgical, then one is all physical therapy, but it doesn't tell when a patient needs to go to surgery.
Mm-hmm.
It doesn't tell when a patient needs to stay out of the ER. There's still a gap
Mm.
at the front end.
Mm-hmm.
And we call that the white space of orthopedics. And that's what Upswing fills. That very first ouch moment. What do I do?
Right.
Come to us. We'll give it to you exactly what to do. That
Right.
makes sense?
Absolutely. Yeah, that ouch moment. Just like, well, everyone's experienced that, whether it's you pinch something in your back or you, I don't know, even if you took a tumble and you did something with your
Sure.
elbow or something, right? So the first thing you want to know is, did I break
Right.
it? And
Right.
do I have to go? Yeah. Do I need to go to the hospital to get a break assessed or something more serious? Because that's the first thing you think about. Well, is this serious or is this something
Exactly
I
right.
can get through? Right. So
Exactly right.
to
It-
hear, oh well, you know what, you don't have a break, you just have a sprain, and here's some exercises you can do, and here's this you can do, would fast track and get me back on track and avoid
quick.
all of that. Yeah, I can totally see that.
And
Brilliant.
people have very busy lives. They have kids and
Yeah.
grandkids, and they don't want to go to the ER. They don't want to go to the doctor, right? They just want an answer to their question. So our market, Heath, is mostly self-funded employers
Mm.
and their ecosystem of brokers and consultants and that whole world around self-funded employers. And when we look at their data, um, the three big categories of buckets of spend is orthopedics, cardiometabolic, and cancer care. And depending on the demographic of the company, maybe one or the other.
Right.
But
Right.
orthopedics, we call it MSK, is always one of the top three, right? And then we look at their data of where are their pain points.
Mm.
Well, it's again so much ER use for non-ER problems.
Oh yeah.
It is wasted MRI scans for people that didn't need an MRI scan.
Right.
It's the wrong side of an MRI. So if you go to a hospital for an MRI scan in this country, $1,800, $2,000. I can get an MRI scan through our third-party vendor for $350.
Oh wow.
So I mean, all of these types of things.
Significant.
But it's been slow, and I'm not going to tell you it's been easy because of the things you brought up from the very beginning, and that is why hasn't it transformed faster?
Mm-hmm.
And it's because of the perverse incentives to a large extent, because we have to work through those intermediaries.
Mm-hmm.
Every one of them has a piece of it, right? And when it comes to the employer, they're not appreciating yet their fiduciary legal responsibility. They don't
Mm-hmm.
understand it yet, despite it's hard to imagine, but a lot of them don't. You talk about the CAA, they go, "What's that?" And then it comes to even when they do know about it, they think they've got everything, the boxes checked. That's not good enough anymore, Heath. They
Mm-hmm.
have to look at the outcomes of that box. Is
Mm-hmm.
it giving value to their members, or is it just a box you're checking?
Mm-hmm.
But healthcare is brutal, man. It takes a lot of time.
Yeah, it's a quagmire to manage.
It's tough, but we'll tell you, every year we're now approaching $5 trillion with horrible outcomes and sicker population every year.
Yeah.
It's time for a change.
Well, it's these kind of ventures that are at least cracking the door open to say there's other ways to do this. There's other ways to approach this. So tell me, when you started Upswing, the vision was to do exactly that, is to streamline the process, give patients quicker access. What was your vision for the company as far as that growth? Like you said, it's a little bit slow on the uptake, but what what was the vision for the growth of the
Yeah,
company?
I love that question because even when we launched, and maybe it comes from my primary care background, but a couple of things are in our DNA. One is we've got to work with primary care organizations, which is why we have relationships with Galileo and Recuro and 4 direct primary care organizations, because the pairing of good primary care and good orthopedic management doubles down the value to the purchaser,
Mm,
right? So where I'm going with that is from our perspective, we always intended to be something more than just an orthopedic company. We want to be something part of a bigger organization,
mm.
right? We're probably going to go out, raise an A round in the fall, and hire more people and keep banging your head against the wall with a bigger, no,
Bigger facility. Yeah.
always looking for something to roll up into,
Right.
to be part of a larger organization. I'll tell you, you probably don't know Professor Porter or Kaplan, but they really are the architects of the value-based healthcare agenda, right? Porter's seminal book, 2006, maybe 2006, called Redefining Healthcare is iconic now by
Mm,
Porter and Teisberg. Anyway, he spoke about, this is now 17, 18 years ago, talk about organizing healthcare by conditions. What he meant by that, he called it an integrated practice unit. So 45% of our patients at Upswing are obese. I bet you half of them have behavioral health issues,
mm.
diabetes, heart disease. Why do we have to have one-off solutions for every one of these companies, right? Somebody's got to roll us up into one big happy family
Yeah.
and address it based on the condition.
Yeah.
And we're hearing a little bit of this because so you can say which condition should be the IP? Should it be MSK and all of our wraparound?
Mm-hmm.
Probably should be obesity or diabetes management, and then wrap around all of these other services into this more holistic, integrated. Now, think about for the patient, beautiful.
Yeah.
Think about for the purchaser, even more beautiful.
Yeah.
They don't want to have 18 different free contracts, right? With every little solution.
Yeah.
So our vision is to roll up into something. It's not out there yet, and we're
Yeah.
looking and thinking, be it either something horizontally, where we can
Mm-hmm.
be part of an integrated practice unit focused on maybe it's obesity or behavioral health, or roll up vertically into something like an advanced primary care company or something like that. So that's on our 3 to 5 year radar, or less. Who knows?
That's yeah. If it could be less, that'd be great. Yeah, that's interesting because then you've got you can have all these sort of almost like their intake funnels. Oh, I got to sort back, so they would go to a particular upswing, for example, or I'm experiencing heartburn. I don't know why, so they go see another one. We're in this era now of all this access to information, all this data, but it's all fragmented. Everyone's collecting all this data, but it's not connected. So I can go through Upswing, or I could go through UberDocs, or I could go through any of these portals to get access to some sort of healthcare. But because my profile is each one, I have a profile on each system, but there's no connection to all of my conditions or all of my reports, where there's one place to say, and now with the age of AI, to say, to have AI reviewing my health report to say, oh, this person is at risk of heart disease due to their weight, or this person is at risk because of they are a smoker. And so there's no real centralized information hub where all the patients can be assessed, and their diagnosis or their treatment plan or their recovery plan or whatever, it can be seen by all healthcare workers.
Yeah, Heath, your questions are so prescient. They're really excellent because that's nirvana. It's called interoperability. So
uh,
let's say you had this integrated practice unit,
Interoperability, I like that.
interoperability. But let's say you had this integrated practice unit focused on the condition known as obesity, and you had obesity medicine, orthopedics, diabetes medicine, behavioral health. It wouldn't matter which portal the patient came in. They may come in
Right.
with an orthopedic problem first, right?
Yeah.
But then all of these solutions are connected, right? That makes me so happy, just even visualizing that.
That could
Because we've
possibly
all been
happen.
patients before. You've had families. No one knows about, no one talks to anybody.
Hmm.
And I hope that somebody from private equity will listen to this podcast and say, Steve had a great idea. With his suggestion, we can go into business together.
Okay, sounds good.
Honestly, that would be nirvana.
Yeah.
And it would be a roll up amongst roll ups that an employer would crush it,
Yep.
right?
Yeah.
So you asked a great question, and it really is about that interoperability, about focus on the patient, the data. Imagine a better world under those conditions. Yeah. Yeah, I'm always looking for the best. I really do care for patients a lot, as all physicians do. And I feel for them when they're on these horrible, disparate journeys and they're
Yeah.
dysfunctional and they get
Yeah.
bounced from one doctor to another. And it's just wrong. And it is hard to change. But again, there are some areas of inspiration, and
Hmm.
hopefully Upswing will be part of that. We have a small but mighty team. Startup world, as you know, is not for the faint of heart. it's a
Yeah.
it's a 7 day a week gig, and at least in my brick and mortar world, I understood the players, I
Yeah.
understood the challenges, the obstacles. Right, even
Yeah.
when they were big, I knew how to get through them.
Yeah.
In this world of intermediaries between the patient and the employer, the people paying. There's so many intermediaries and they all have very perverse incentives that it's hard to conquer that. You don't even know what they
Yeah.
are, let alone try to fix them. Right?
Right. Right.
But
A couple
there's
more questions about
please.
Upswing too. So as an individual, so I notice like you have individuals and for employers to find information, but as an individual, so I have an ouch. I sign up. I pick my plan, which is really well priced actually. And then does it matter where I am? Like, is it geographically restricted, or is all my assessments done online? Does it really matter, or is there some tie-in with where I'm actually?
Oh, of
Well,
course.
I
Yeah.
said in the United States for sure, but
Yeah, no, that's really important. So when you launch a national company, the first thing you have to do is set up uh, the corporate infrastructure in each state.
yeah,
So
yeah,
you need the PC and an MSO in every state. PC is the clinical arm, the MSO is a business.
right,
Um, and there are a couple of what's they call it foreign qualified.
hmm.
There are a couple of states that'll foreign qualify a number of other states,
Oh, I
almost like
see.
a consortium.
Hmm.
So we have the corporate infrastructure now in 48 states, and we have physicians in about 35. So both the physicians and the athletic trainers
Hmm.
have to be licensed in that state to
Right,
see a member.
right,
So you may ask, what about the last 15? We just haven't had any business in those states.
right.
So for us to stand up
Supply and demand,
this
right?
and
Yeah,
pay them for any business doesn't make any sense.
right,
Well, yeah, so they would come on. We would adjudicate what state they're in and make sure that our coaches and physicians are licensed in that state.
right. So 2017, you kicked this off, and now it's full swing. I mean, COVID must have been a great experiment for you. It was a great test drive shortly after launching. Did you see a big uptake
Yeah,
during
we
COVID?
did. And although if you look online, it saes we launched in 2017, we actually were a different company then, Heath.
Oh, I see.
It
Okay.
was a different model, and I won't go into that, but it really became Upswing actually just before COVID in about January 2020.
Oh,
So
okay.
yeah, no, we had a good bounce during COVID, and then things gradually go back to status quo, and
Right.
but we're getting there. We're getting there. There's that diffusion of innovation principle where you work, you work, you work, you work, get a couple of early adopters, and you get to that inflection point at around 16%. We're out now for another capital raise because you always need to kind of raise money, and
Yeah. Yeah.
technology is expensive. We have
Oh,
developed.
wow. No kidding.
So, we're always raising a little more capital, but I think we're in a good position. I'm not going to kid you, it's been the most difficult of all the challenges I've taken on. This is by far the most difficult.
Is that right?
But I
Yeah.
love it. You get these calls with people that instantly click. and they go, oh, God.
Yeah.
So
This
my
is why I do this. Yeah.
instantly clicked, and then let's do business.
Yeah.
And then you get some of the others with other stakeholders where it's, yeah, we'll call you back, and you know where that's going.
So, I mean, the best case scenario is that you're bringing on employers because they bring multiple people under
Yeah.
their fold, but individuals too. So you'll have a combination of chronic people with chronic pain who
Ooh.
need ongoing support, but then you have that acute sort of one-time pain, that ouch moment where so there's a revolving door of those types, and then maybe some with more chronic that are regular users. But the employers is that's the sweet spot, right?
Yeah. Yeah. No, it's very interesting looking at our data. I'll tell you honestly, that 70% of our patients would call their condition chronic. They just
Oh,
can't get an answer. They can't see an orthopedic surgeon. Yeah, 70%.
wow.
So it's we were designed as an acute care company, but
Huh.
people just love to get an answer to their problem. And we have various pricing models, but because we're virtual, the unit economics work very well. We can be
Yeah.
very inexpensive,
Yeah.
which is another reason why it's shocking that all employers don't say we all want Upswing, because the
Yeah.
price points. We did some data. The largest client we have, which is a big one, is a state of Connecticut health plan.
Oh,
We're based in Connecticut, and it's a whole nother story how we got this gig, but we earned it. We did a free pilot for 15 months, free to them, not free to us.
right.
It was expensive, but we got some good data, and we knew we would get good data, and that data then got us the full contract, and then we got some real data, not pilot data. But the real data, which was amazingly statistically significant, where this third-party vendor created statistical twins in Upswing users
Yeah.
versus Upswing non-users. How did they do that? They had a 1 year pre-claim history so that there was no selection bias,
Right.
and then they had a 1 year claim run out, right? So, and then they matched them for 6 different things. So
Hmm.
they created statistical twins, and within that statistical twins, they found that those users saved the state 53%.
Wow.
53% on their orthopedic spend.
Wow.
It reduced their PMPM per member per month by $189 per member per month. We had no use of the ER, zero. We
Wow.
saved, yeah, I mean, on and on and
Like
on.
that case study is enough to sell to anybody, really. Yeah.
Well, it became a big sales tool, but
Yeah, I bet.
people have to listen to it. We
Yeah.
published this data.
Yeah.
Yeah, it is a bit frustrating that people will say, "Oh my God, 50."
What do you
And
what's the biggest pushback that you find?
well, it's getting to the decision makers, right? I mean,
Right.
you don't just call the employer. They'll say, talk to my broker. And, you just, and
Yeah.
also we can't build a business one employer at it. This is why we need the brokers.
Yeah.
You can't keep knocking on doors one employer at a time. I mean, we'll be long gone. So
Yeah.
you need the brokers who have these employer relationships.
Mm-hmm.
So, but there are different types of brokers, really quick. There are those that are aligned with a BUCA, what the BUCA acronym is, Blue Cross, United, Cigna,
Oh,
Aetna.
right. Yeah.
And then there are the independent fee-based brokers.
Hmm.
They are certified by the Health Rosetta. I don't know if you've
Mm-hmm.
heard about the Health Rosetta.
Yep.
Again, they're really important. And they're fee-based. They don't get commissions. They get a piece of the savings, which
Right.
is the way it should be.
Yeah.
So those are kind of our buddies, finding those independent baker that are non-conflicted.
So that's the kind of the core of your marketing is targeting those people and trying to find the decision makers in that area. Steve, thank you so much for your time today. I really appreciate you and your story is fascinating. I could go on for another hour here listening to you and having this conversation. So thank you for your time. Any closing remarks or anything you'd want to say before we wrap it up?
Yeah, no, first I appreciate you again having on. I enjoy telling the story, and I hope it is really meant to inspire young entrepreneurs. Find a problem and go fix it and stay with it, and just follow your passion. And like my mentor told me, right? You got to leave it better than you found it. I think that's
Yeah.
a great message for all of us.
I think that for all of us, leave everything better than we
For all
found it.
of us.
Absolutely. Thank you so much.
Thank you, Heath. Appreciate your time.
Fantastic conversation with Dr. Schutzer. I really enjoyed listening to him explain how Upswing is adding so much more value to orthopedic care and sort of easy access or early access. There's so many solutions popping up now with digital technology, AI, and all these sort of really inspired visionaries who see that there can be change, that change is possible, and that it just requires some visionary thinkers to bond together and build these startups. It's inspiring to hear about Steve's entrepreneurial journey. That spirit for him is essential for addressing these challenges in healthcare. But effective communication is the key. And as Steve says, the startup journey in healthcare is challenging, but definitely rewarding. So great advice. You can find Dr. Schutzer on LinkedIn, or you can visit the website upswinghealth.com. Thank you again for listening to another episode of The Healthy Enterprise, and we will talk again soon. Bye for now.